Our shoulders, intricate masterpieces of nature, grant us the freedom to move, lift, and engage with the world. Yet their complexity makes them susceptible to a range of painful conditions, impacting our daily lives. From the sharp pangs of a rotator cuff tear to the debilitating stiffness of frozen shoulder, shoulder pain can cast a shadow over our ability to perform even the simplest tasks. This intricate joint, a marvel of biomechanics, deserves our attention and care. It ripples through our lives, affecting our work, hobbies, and overall well-being. The inability to lift a coffee mug, play a musical instrument, or even hug a loved one can be emotionally draining. It is therefore essential to understand the intricacies of shoulder pain, its causes, and the myriad approaches to healing. The shoulder joint, a testament to the ingenuity of human evolution, is a complex structure that allows for a remarkable range of motion. This mobility comes at a cost, however, as the shoulder's intricate design also makes it susceptible to injuries. To truly understand shoulder pain and its treatment, it's crucial to first grasp the anatomy of this remarkable joint. 3 bones form the foundation of the shoulder: the humerus, the scapula, and the clavicle. The head of the humerus fits into a shallow socket on the scapula called the glenoid fossa, creating a ball and socket joint. A network of muscles surrounds the shoulder joint, providing stability, strength, and movement. The rotator cuff muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, play a crucial role in controlling the shoulder's rotation and lifting. Tendons, these tough, fibrous cords, connect muscles to bones, enabling movement. The tendons of the rotator cuff muscles are particularly vulnerable to injury. Ligaments, these strong bands of tissue, connect bones to each other, providing stability and limiting excessive movement. The ligaments of the shoulder joint help hold the bones in place. Bursae, these small fluid-filled sacs, act as cushions between bones, tendons, and muscles, reducing friction and allowing for smooth movement. This intricate interplay of bones, muscles, tendons, ligaments, and bursae allows us to perform a wide range of movements, from throwing a ball to reaching for a high shelf. However, this complexity also makes the shoulder susceptible to injury. Understanding the anatomy of the shoulder joint provides a foundation for comprehending the mechanisms of shoulder pain and the rationale behind various treatment approaches. Frozen shoulder, also known as adhesive capsulitis, is a condition characterized by stiffness and pain in the shoulder joint. Imagine reaching for your morning coffee, only to be met with a searing pain and the inability to fully lift your arm. This is the harsh reality for many suffering from frozen shoulder. This debilitating condition occurs when the capsule surrounding the shoulder joint becomes inflamed and thickens, forming adhesions that restrict movement. While the exact cause of frozen shoulder remains unknown, several factors can increase the risk, including age. It most commonly affects individuals between 40 and 60 years old. Gender. Women are more likely to develop frozen shoulder than men. Prolonged immobilization. Keeping the shoulder immobile for extended periods, such as after surgery or a fracture, can increase the risk. Certain medical conditions, diabetes, thyroid disorders, and autoimmune diseases are associated with a higher incidence of frozen shoulder. Frozen shoulder typically progresses through 3 distinct stages. The freezing stage, characterized by increasing pain and stiffness, making it difficult to move the shoulder. The frozen stage, where pain may decrease, but stiffness persists, severely limiting the range of motion. And the thawing stage, with gradual improvement in range of motion and a decrease in pain. The duration of each stage varies, but the entire process can last for months or even years. Understanding the stages of frozen shoulder is crucial for tailoring treatment plans and managing expectations for recovery. The rotator cuff, a group of 4 muscles surrounding the shoulder joint, is vital for shoulder stability and movement. These muscles and their tendons act as a team, controlling the arm's rotation and lifting. When one or more of these tendons tear, it can significantly impact shoulder function and cause pain. Rotator cuff tears can occur due to an acute injury, a sudden, forceful event such as a fall or a direct blow to the shoulder. Overuse, repetitive overhead motions, common in sports like baseball or tennis, can gradually wear down the rotator cuff tendons, leading to tears. And degenerative changes, As we age, tendons naturally weaken, making them more susceptible to tearing, even with minor injuries. The severity of a rotator cuff tear can range from a partial tear, where the tendon is damaged but not completely severed, to a full thickness tear, where the tendon is completely torn through. Symptoms of a rotator cuff tear can vary depending on the severity of the tear. Some individuals may experience pain, especially at night or when lifting the arm, weakness in the shoulder, a crackling or popping sensation when moving the shoulder. Ignoring the symptoms of a rotator cuff tear can lead to further damage and chronic pain. It's essential to seek medical attention if you suspect a rotator cuff injury. Traditional approaches to shoulder pain often involve a combination of several treatments. Medications like pain relievers and anti-inflammatory drugs can provide temporary relief from pain and inflammation. Physical therapy, which includes exercises and stretches, helps improve range of motion, strengthen muscles, and restore function. Injections, such as corticosteroid injections into the shoulder joint, can reduce inflammation and alleviate pain. And, in severe cases, surgery may be recommended to repair torn tendons or release scar tissue. While these conventional treatments can be effective for some individuals, they often come with limitations. Medications can cause side effects, such as stomach upset, heartburn, and even addiction. Many traditional treatments focus on symptom management rather than addressing the underlying cause of pain. Surgery, though sometimes necessary, carries risks and requires a lengthy recovery period. Moreover, traditional approaches often overlook the interconnectedness of the body and mind. Pain is a complex phenomenon influenced by physical, emotional, and psychological factors. Integrative therapies, on the other hand, acknowledge this interconnectedness and aim to address pain holistically. Acupuncture, an ancient Chinese healing practice, has gained increasing recognition in the Western world for its effectiveness in treating various conditions, including shoulder pain. This time-tested therapy involves inserting thin needles into specific points on the body, known as acupoints, to stimulate the body's natural healing processes. But how does acupuncture work? According to traditional Chinese medicine, acupuncture needles unblock the flow of qi, or vital energy, along meridians or energy pathways throughout the body. These meridians connect to different organs and systems, creating a network of communication within the body. From a Western medical perspective, acupuncture is believed to release endorphins, the body's natural pain-relieving chemicals. It can reduce inflammation by modulating the immune system's response. Acupuncture can improve blood circulation to the affected area, promoting healing. Acupuncture offers a safe and effective alternative to traditional treatments for shoulder pain, providing lasting relief without the side effects of medications or the invasiveness of surgery. Electroacupuncture takes the principles of acupuncture a step further by incorporating electrical stimulation. A small electrical current is passed through the acupuncture needles, enhancing the therapeutic effects. This stimulation increases endorphin release, providing more potent pain relief. It helps relax tense muscles, reducing stiffness and improving range of motion. Some studies suggest that electroacupuncture may promote nerve regeneration, beneficial for nerve-related shoulder pain. Electroacupuncture offers a safe and effective way to amplify the benefits of traditional acupuncture, providing enhanced pain relief and promoting healing. Dry needling and active release techniques, ART, are two distinct but complementary approaches that target musculoskeletal pain and dysfunction. Dry needling involves inserting thin needles, similar to acupuncture needles, directly into trigger points or knots within muscles. These trigger points are hypersensitive areas that can cause pain and refer pain to other parts of the body. Dry needling aims to release trigger points, alleviating muscle tension and pain. Needling can increase blood flow to the affected area, promoting healing. It can modulate the inflammatory response, reducing pain and swelling. Active release techniques, RT, is a specialized movement-based technique that focuses on treating soft tissue adhesions and dysfunction. ART combines precise manual pressure with patient movement to break up adhesions and restore normal tissue glide. Addressing postural imbalances can reduce strain on the shoulder joint and prevent future pain. Both dry needling and RT offer targeted approaches to addressing musculoskeletal dysfunction, providing pain relief and restoring function. Shoulder pain, whether from frozen shoulder, rotator cuff tears, or other conditions, can significantly impact our lives. While traditional treatments offer some relief, they often fall short of addressing the multifaceted nature of pain. Integrative therapies, such as acupuncture, electroacupuncture, dry needling, and manual therapy, provide a holistic approach to shoulder health. These therapies aim to identify and treat the underlying causes of pain, not just the symptoms. Integrative therapies recognize the interconnectedness of the body and mind, addressing physical, emotional, and psychological factors that contribute to pain. These therapies empower patients to take an active role in their healing journey. If you're struggling with shoulder pain, I encourage you to explore the potential of integrative therapies. These approaches offer a safe, effective, and holistic path to healing, allowing you to reclaim your freedom of movement and live a life free from pain. Remember, you are not alone in this journey. Many healthcare professionals specialize in integrative medicine and can guide you towards the most appropriate treatment plan for your individual needs. By embracing a holistic approach to shoulder health, you can unlock the body's innate healing potential and experience lasting relief. Michael Woodworth is one of the only providers to offer advanced orthopedic acupuncture, dry needling, electroacupuncture, and active release techniques in combined treatments to resolve difficult-to-treat musculoskeletal conditions. Visit his website for more information on how to schedule at www.makarywellness.com.